and welcome to our webinar, High IQ, ICD-10s, and you. Thank you very much for taking time out of your busy schedules today to join us. We're going to be using this time this morning to go over a bit about the ICD-10 mandate that's fast approaching November 1st, which is basically a month away from us today. So we're going to go over some of the things that we can do within High IQ to get ready for that, and have a couple people here today that are going to work you during this presentation to talk to you about what we can do in High IQ to make that a little easier for you. I am going to be the moderator for you today, and of course, for those of you who don't know me, and Heather Noguera, I'm your Strategic Accounts Manager. I'm a licensed medical technologist and graduated from Stonehill College many years ago. I've been working here at High IQ for a little over 4 years now. Account manager, and I deal with both the new and existing accounts to provide some workflow solutions for the existing accounts and bring on new sales and hopefully improve everybody's usage of High IQ throughout the system. To help me here with my partner today in time is Ms. Evan Lozon, our expert on ICD-10s. He's our software design director, and he has been here with us at Connexus since 2004. As we all know, he is a RT and was using High IQ at the Miriam Hospital, where that was first experience with the software, but actually uses his clinical experience to help make the software better for us here and for you to utilize during the customer experience. So helping to develop the software for the future High IQ and develop IRIS, newest version of High IQ, which you will all be utilizing in the very near future. So I wanted to let you know just a couple little house cleaning things. We'd like you to save your questions till the end if possible. However, if you do come up with something in the middle of the presentation, please feel free to type them into the chat box, which is right there on your screens. And we will make note of them and answer them at the end of the presentation. And with that being said, I am going to turn this right over to Pro Kevin Lozon to tell us a little bit more about ICD-10. So with Kevin, forward.
Great, thanks Heather. Thank you very much everybody for attending and joining today's webinar presentation on ICD-10. Today we're going to the 9s and the 10s and the functionality currently within High IQ, as well as the transition going from ICD-9 to ICD-10. How and what that means with interfacing, communicating with other systems in your environment. A little bit about reporting, your next steps going forward. And I hold quite to the end, so feel free to use the little chat box and ask away. So what are ICD codes in general? So classified and created back in 1900. So V1 came out in 1900, and then in the 70s, ICD-9s were created and developed by the World Health Organization, also known as WHO. These ICD-9 codes, and the U.S. decided, hey, we want to add more information and modify these codes, so they created their own classification of the WHO standard, this CM, or clinical operations. To end, what the United States or the CMS, the government, has done is they've separated ICD-10 codes into two classifications, very distinct. CM, diagnoses and causes of death and related to death and disease, as PCS for procedures. So PCS codes used to be bundled right in the ICD-9 into different volumes. So there are 3 different volumes, and volume 3 were PCS codes. Your own classifications in the ICD-9 world. The right-hand side of the screen that we're looking at is just a quick screenshot of what the ICD-9 codes look like currently in IRIS. So for those that don't know, we have 2 versions of High IQ Classic, which is the system that probably we're using today, and High IQ Iris, which is the next platform, which is completely web-based. So both systems do have ICD-10 functionality, so don't worry, come October 1st, if you haven't been migrated to Iris, you will have complete functionality to do your day-to-day job utilizing ICD-10s. The difference. My good friend, Mr. IT or Mr. Doctor here on your screen, I notice a huge difference. So we're going from ICD-9 codes to about 13,000 codes. Small, mid, alpha, E, or V, first leading character. Odds are 3 numbers with the decimal point with a couple of numbers to the right of the decimal, 49.20. That's typical ICD-9 code. And ICD-10s, we're multiplying that by almost 6 times. So taking diagnoses, different causes of death, and we're applying that by almost a factor of 6, and we're getting very complicated and very complex just for individual diagnoses. Or the first digit is always alpha, so it goes from A to Z. So you have 26 classifications, and characters are numeric, and characters can be alphanumeric. So you have a limitless, or you do have a limit, but it's a very high ceiling of how many ICD-10 codes you could potentially have. Just like the U.S. has modified and customized the ICD-10 code set, and the ICD-10s were actually released in the late 90s. So IQ, as well as the rest of the infrastructure here in the U.S., we're finally adopting ICD-10s after a 15-year wait, while the rest of the world has been using them. Good. And the reason being is that by implementing ICD-10s, we're going to analyze all of data that we did have in the past. Meaning before, we're going to have very granular information that we can analyze, study, and use patient health and outcomes, and hopefully just become medicine. So that's the goal. What's used in High IQ today? For those of you that are documenting packages in IQ and Classic High IQ, you probably have some services, some ID codes, as well as CPT codes bundled. So then you do your IVC filter, all of these codes automatically just stamped and associated to your account. That's one, and it's important to note that we utilize CM codes only. So in High IQ, we've always used Cs, which are synonymous with diagnosis. We don't have PCS codes inside of High IQ. The procedure documentation is quickly dented with CPT codes if you're utilizing CPT codes. At the very least, you're documenting services. Services were created by the Society of Interventional Radiology and is maintained by the SIR. What they've done is they've associated the most common CPT-9 codes, specifically ICD codes, in the past with the services. The update in High IQ, what we'll do is we are going to update the services that have their corresponding ICD codes, as well as any performed procedures if you're in IRIS or packages in Classic High IQ. We're also going to set that moving forward as you do your case documentation, High IQ will present to the end user ICD-10s and allow you to document ICD-10s and report on ICD-10s. So, and to note that you move forward, all your historical data, ICD-9s, will be still there. It's going to be captured. So the reports will have a mix, potentially of having ICD-9s and ICD-10s if you pick dates that overlap. So I do all this. Well, we started off with the 650 total and active ICD-9 CM codes in IAQ today. So using IRIS or IAQ Classic, if you go into your Dialysis Master, you'll see only 650 records. Now it was developed, we didn't import all 13,000 or at the time probably 7,000 or 8,000 codes. The reason being is that what the SIR did is they trimmed down that set list so that ultimately, or approximately, so they're very pointed and directed towards image-guided interventions. So you're not seeing stuff like bus accident or sore foot inside of high IQ. The reason why is that the good folks at SIR trimmed it down so the bare minimum just to you're documenting your guided interventional procedures. Now, what the SAS has done for us and for other software vendors is they've created a GEM, equivalence mapping table. So it gives you a list of all the current ICD-9 CM codes and the corresponding ICD-10 CM codes. And what we can see in the bottom diagram there in the center box is we now have 886 active codes within high IQ, 70,000. This is some user feedback. We did send out surveys months ago, actually probably years ago when the ICN Go Live was scheduled for 2014. Here in 2014, we sent out some surveys, and some of you folks have responded and said that you'd like to see all the codes in the system. So only activated the 886 ICD codes that had a match to the ICD codes in your database. It's also important that if you've modified your instance of high IQ, your database, and have additional ICD-9 codes, when the switch, what that's going to do is it's going to find the corresponding 10 and automatically activate and update packages and services for you. As the program displays, you also will note that we do not have any PCS codes for the system. A little bit of thing. So it's important to note that if you are a current IRIS customer, you do not have the capability to flip the switch to enable ICD-10s. That's why I want you to reach out to us, talk to the implementation manager, Eileen or Jeremy or myself or support. You are going to have to reach out to us in order to enable ICD-10s for the October 1st go live. For testing, same deal. You're going to tell us first, we'll flip the switch, and your test environment will be updated with ICD-10s for you to go around and inspect and get ready for your October 1st go live. Now, you can, by all means, do this for test and production. However, let us help you with that. On-premise, or you're having us host your application, just put a request, we'll work with you, October 1st, we'll flip the switch, make sure everything's good, we'll poke around, test the database. By all means, for testing, you can do that right now, and you should do that today. So test environment and your classic high IQ, here are the steps. It's only for testing purposes. For go, call us. So what you're going to do is go to File, Preferences, and Quality Assurance, and you can see the red highlighted box there, just ICD-10. And what that's going to do is it's going to update all of your packages, services, and the 10 table. Here's an with ICD-10s enabled in Classic IQ for a package. You'll have the ICD-10 codes highlighted, and before you do flip that switch and test, and you'll notice that some of these packages or perform procedures or services will maybe 3 or 4 ICD-9 codes. One switch, that 4 could probably turn into 10 to 20. And the reason is that you're getting more and more specific right down to sometimes the blood vessel, the anatomy, whether it's left, right, and so forth. So check out today inspiration so that your end users aren't surprised when October 1st comes. Here's another of the high-IQ encounter. And we have venous access with an external port. So it's a chest port or maybe perm-cath. And you can see specifically how detailed these neoplasms and secondary and neoplasms, how get more and more specific. So, for example, this service may have had 5 or 6 common ICD-9 codes. We're now looking at 18 in the list. So, how is it getting to and from IIQ? With IQ, we're unable to process the inbound DG1 or diagnosis segments from your ADT or orders interface. So we're due to code limitations and software limitations. However, we're always able to send that information out. If you were documenting that for a billing interface and CPT codes and or inventory, we could piggyback the codes in reality. So you're doing that today. When you flip the switch, part of your test process, you now see that in ICD-10 codes coming out of IIQ. Because of such a new system, we're able to build from the ground up very specific interfacing. And we're able to process inbound, and we can map that directly to the patient's encounter and iris. We can also send that out and billing interface. So how would you use it other than just documentation? Well, you can run reports. The service activity report coming straight from iris, and you can see at the bottom left-hand screen, I have outlined the diagnosis for vascular disease unspecified. And what this is allowing me to do is find out what types of services are being performed for the selected diagnosis or diagnoses and the physician operators that are doing procedures. If you think about it, the data analysis is pretty much endless. You can come up with any type of combination and have different group by, say, group by patient, group by service, group operator, and quickly drill down and analyze your data. And it reveals something that you never knew was happening in your department. So it's a good assurance tool, making sure there aren't any outliers, and if there are, maybe dig in a little bit deeper and find out what went wrong, or what did you do differently to help you define a new process. Heather, what do you think?
The moral story, Kevin, if you use ICD-9s today, you got to start out testing those ICD-10s immediately, because we've only got a month left to go. So got to get up.
Yeah, a lot of our customers have already reached out and if emails are giving us a quick call and hey, we use ICD-9s, how do we switch over to 10s? And basically that's it. You've seen how you do it in classic high IQ in your test environment. Reach out and let us know when you go live, and how would you like to help you and hold your hand with that process.
But the best thing to do too is share your plans with us. We really like to hear what you're going to do because it also helps us with our plans for the future of IQ and how we're going to plan moving forward. What you're now affects things on how we're going to move forward in the future, and it'll also help us plan for other customers and what they're going to do and how they're going to test as well. So if you can help us by sharing your plans, that would be wonderful too.
Throw this out. It's just not ICDs that we care about with plan. Anything that involves workflows or process flow, feel free to share that with us because to the development team and bounce off of implementing such as Aileen and Jeremy. And we information and we build the future of IIQ based on your ideas and your needs. So that's very important. So not only ICD plans, all general our plans.
And if you're on IRIS, you have to call us in order to get things switched over for the ICD-10.
Yep, test and production.
Correct. You get the switch for test to do your thing now, but in order to live before October 1st, you have to give us a call so that we can help you out through this process.
And something's undiscovered during testing, we want to know that you are one of the clients, one of the customers that are planning to make that transition on October 1st.
So closing of the presentation itself, we're going to just read the number that you need to call in order to help you out with this decision, and that is the support line. So please feel free to give that number a call. I'm sure you all have it plastered PCs or on speed dial there, but the number is 866-447, and you select option 2, or you can use the web and use support at hiiq.com. We are going to open it up to questions.
I have the first question.
Oh, please.
What happens if somebody calls that number and presses 1?
Well, surprisingly enough, you will sales line.
And what's important about the sales line is for those folks that haven't yet touched base with the implementation folks, and actually give us a call and we'll work with you in scheduling some sort of demo of the new IRIS product, which is very exciting. And you can see firsthand if you haven't seen it already and caught us at the SIR annual meetings or haven't had an invitation or a kickoff call with the kind folks, Aileen and Jeremy.
Thanks for that, Kevin.
Anytime.
But now open it to some questions. So if anybody has questions in regards to ICD-10 and the presentation we just had, I have unmuted all of your phones right now. So please feel free to jump in and ask any